Assalamualaikum and hi everyone. I'm Muhammad Syafie bin Rumuhana, a first year medical student. My matric number is BM24110017, and welcome to my SSM video assignment. And the specialty that I choose is radiology. So let's go. So in this video, we are going to discover different parts. For the first one, we are going to go to the introduction to radiology, the anatomy, and for this part, we are going to discover both gross anatomy and the radiographic anatomy. And the part of the body that I choose is the lungs. So for the biochemistry process, we are going to discover what the process involved in the lungs, the related disease of the lungs, and also the treatment of the diseases. So for the introduction, so what is radiology? So radiology is a medical specialty that uses imaging techniques to diagnose and treat diseases. It involves the use of technologies such as X-ray, computer tomography (CT), magnetic resonance imaging (MRI), and also ultrasound. So there are various types of subspecialty in this radiology field. So for the first one, we have interventional radiology that use imaging to guide minimally invasive procedures. We have diagnostic radiology that focus more on imaging techniques to diagnose injury. Therapeutic radiology, also known as radiation oncology. We have pediatric radiology that focus more on children, and neuroradiology that focus on the head and neck region. Now let's go for the anatomy of the lungs. So what we can see here is the human lungs. We have the right side and also the left side. So for the right side, the lung is divided into three sections. For the first one, we have the right upper lobe, the right middle lobe, and the right lower lobe. As for the left side, we have the left upper lobe and the left lower lobe. Now here is the trachea, and the trachea is divided into two bronchi, which is the green colored part. And this bronchi will further divide it into lobar bronchi. The red colored part here is one of the segment of the segment bronchi of the middle lobe. And the point of division of these two bronchi is called carina. Now we are going to take a closer look into our lungs. So in this picture, we have the posterior view of our lungs, meaning we are looking our lungs from the back. So we start from the outer side. So here we have the apex of the lungs, left and right. On the lateral side, we have the anterior border and the costal surface. Inferior to the lungs, we have the inferior border and the pulmonary ligament. The blue part right here that surrounds all of this part is called as root. The purple one, the purple vessel is the pulmonary artery which the blood goes in, and the red vessel is the pulmonary veins where the blood goes out. And the two tube here is the cut section of the bronchus. And here in the middle we have the posterior border. And below it, we have the base of the lung for both right and left, which in contact with the diaphragm. So now let's see the lungs through X-ray. So what we can see here is a picture of chest X-ray. So the A part here is the trachea, the B part here is the apex of the lung, C is the point of the division between two bronchi called as carina, D here is the base of the left lung. E is the diaphragm. F is the costophrenic angle. G here is the hilum, which is the central area of lung where all of the vessels meet together. Now for the biochemistry part, we are going to look into the process of the gaseous exchange with one of the most important process conducted by our lungs. So gases exchange, there are two types of gases exchange, which are pulmonary and also systemic. So for pulmonary gases exchange, it is an gas exchange between carbon dioxide and oxygen, between alveoli and the blood capillary surrounding it. So the blood convert from deoxygenated to oxygenated. So for the systemic gas exchange, the blood exchange between systemic capillaries and the tissue cells, and the gas convert from oxygenated blood to deoxygenated blood. So in this picture here, we can see how the carbon dioxide is transferred in and out of the body. Now for the related disease, in this case, I chose pneumonia as the disease. So pneumonia is an infectious disease caused by Streptococcus pneumonia bacteria. So it have high susceptibility in younger or older people, as well as alcoholic person. So one of the symptoms of a patient with pneumonia is cough with sputum or mucus that is typically green or rust colored. They might have chest pain, dyspnea, or fever. One of the way we can diagnose a pneumonia is by taking the medical history and conducting physical examinations. Mostly we are using X-ray and CT scan, which typically for severe cases. So what we can see here in this picture, in the left lung of this patient labeled A, this lung have low opacity compared to the right lung. So meaning there are denser fluid presence in this lung. Most potentially is the cause of the infections. So this patient is suspected to have a pneumonia infections in the left lung. So according to the treatments of pneumonia, so there are a lot of treatments offered nowadays to treat pneumonia. So for the first one, we have the antibiotics medications for bacterial pneumonia. So the doctors will prescribe antibiotics such as amoxicillin, deoxycycline, or macrolide. For the antiviral pneumonia, the patients might be prescribed with antiviral medications such as oseltamivir and zanamivir. Other than that, oxygen therapy also offered in case of patients not getting enough oxygen through their normal breathing. Because in pneumonia patients, they often have a breathing difficulty, so the oxygen therapy through oxygen mask will help to assist their breathing. And for the last one, the drainage procedure, for this one is mostly conducted on a severe case of pneumonia where there is accumulation of fluid in the pleural space of the lung of the patients. So the doctors might do a drainage procedure to take out or remove all of the fluid, uh, most potentially the pus formed by the infections of the bacteria out of from the pleural space of the lungs of the patients. And this procedure is quite an invasive procedures. So yeah, that's it. That's all from me. Thank you.